wait a minute, Bart. What was the name of that piece?
It's called Fanfare for a Healthy Woman.
Fanfare for a Healthy Woman. And he wrote it specially for all of you. So, 400, 6, 32, 73, 9, 20, 25, 92, 126, 17, 5, 1, 12, and 9. These are numbers you will remember as we go on with this conference. And it's the quiz is, what are they? And what do they mean? Pretty soon we will know. Good afternoon, everybody. My name is Afaf Melis, and I am the Dean of the School of Nursing here, and I am the Counsel General for the International Council on Women's Health, and I bid you, on behalf of everybody, a real warm welcome. It's so wonderful to have you here, all of you from so many different places, and I want first to give a warm welcome and acknowledge our First Lady of Pennsylvania, the Honorable Judge Midge Rendell. Thank you for being here. And pretty soon, President Gottman will be here, and then we'll acknowledge her, and she will be introduced appropriately. She is our First Lady of the university. It's also my pleasure to welcome and acknowledge the Chair of the Board of Overseers of the School of Nursing here, Rosemary Greco. And now it's absolutely my distinct pleasure and honor to welcome each and every one of you for being here. You have come from so many different places. And this is the 18th International Council on Women's Health Conference, which is pretty soon you will know what that is. And we're so glad that it is here in Philadelphia. And as I look across the room, I see so many people, so many friends, and so many colleagues that I have met in different parts of the world where we partnered. And it's great to have you. So I know many of you speak so many different languages. So I want you to pick up a welcome from your own, whichever language you speak, because I can't say from your native language because many of you speak so many languages. So I want you to pick up one word that depicts welcome. And on the count of 3, I want you all to say it at the same time. 1, 2, 3. One more time, loud. Fantastic. Welcome. Welcome. Well, it's like sort of a symphony with so many instruments in it. And but at the end, with all these instruments, it comes out to a wonderful, coherent symphony. And that's what this group gathering is about. 32 countries. So here's one of the numbers. So 32 countries and many, many disciplines. We have the number of the 17 disciplines communicating together in so many different languages and so many different conceptual frameworks. It's music to our ears, and it's going to create something that's going to be lasting. So there are 400 participants. Not all of them are here yet because there are still some arriving. The university planned this conference in collaboration with the International Organization of Women's Health. And I don't know if the person who is the mother of person whose idea was to bring together a collection of people to empower women around the world and to organize women and to create a medium for people to speak together. Dr. Phyllis Stern, I don't know if she's in the room yet, but she's probably arriving late at night, so we will find a way to acknowledge her, and there is a lecture in her name, and this was established. So this whole collection was established in 1984. We have hosted 17 conferences before this, and many of you have been in conferences before. We had them in Canada, in the United States, in New Zealand, in Denmark, in Botswana, in Thailand, in Egypt, in Korea, in Brazil, and in Australia. And this is the 18th one of those. But it is for us here in the University of Pennsylvania, it is the second international conference on women's health. We are thrilled that you have come from far away places and to join us. And I know one thing that really puts us all together on the same page is that passion for making a difference and advancing women's health. This time it is in urban areas. Sometimes in other times it has been different aspects of women's health, but this time it's women's health in urban area and having an urban agenda. I think we all know, and you're going to hear more about that, countries throughout the world are rapidly urbanizing, particularly in the developing world. And for the first time in human history, the majority of people today are no longer living in rural areas, but rather in cities. In fact, today more than half the world live in urban areas, and it is predicted that 2/3 of the world by 2030 will be living in urban areas with all the issues. And there are, of course, the mega cities too. It's not only urban areas, but there are also the mega cities that are going to be doubling in few years. But what's even more staggering is that 32% of the world urban population live in poverty and slums. And of course, because this is women's health, 70 to 80% of those living in poverty areas are women. And that's why we want to focus on that. So increasing urbanization creates, this morning we had a pre-conference about disability and urbanization and women's health, and we learned that it affects every aspect of an urban area: housing issues, transportation, water, sanitation, food security, violence, and of course urbanization also increases disparities, highlights disparities that have already been existed, and it affects education. And I think all those impact health. We can't really deal with health until we deal with all those issues. And women are at the core of a thriving community, of any community, and make communities thriving. They are the mothers, the providers, the leaders, the caregivers, the teachers, the volunteers, and therefore they are affected the most. And by affecting them the most, we affect the community. So we want this conference and this gathering and all your thinking and all your presentation to ignite a dialogue about urban areas, about women's health and urbanization and women. We want to generate a momentum about gender and urbanization. We have on the campus here and in many places a momentum about urbanization. We want to ignite a passion about the connection between those two areas. So we're delighted to have received 300 abstracts from 36 different countries. 300 abstracts from 36 different countries. 92 of those, and here are some of the numbers, 92 of those will be presented in oral presentations. 126 will be presented as poster presentations. And we held a number, I mentioned, pre-conferences, and one of the pre-conferences is called Witness to Hunger, and it is an exhibit of photographs, and it is in Cohen Hall, which is just on your way to the hotel, and it's a very powerful statement about the relationship between hunger and housing, and hunger and living, and hunger and disparities. It really will touch you at the core of your heart, and it will stay. Sometimes the art depicts far more than any words can depict. So they are beautiful photographs taken by women themselves who are living this in poverty. And so it is their own perspective about their own lives, which makes it really powerful and touches you to the core. And there were other wonderful pre-conferences this morning. We have a very special exhibit on display here called Through Your Eyes, which takes an inspiring look into the lives of 7th grade elementary school girls from George Washington Elementary School. The creation of this exhibit was led by Judy Gillis, a very talented photographer. Judy, are you here? Judy Gillis, right there. Thank you, Judy. She gave cameras to 7th graders and asked them to take photographs from their perspective about their own community. And they are hanging right here in the lobby, so please take time to look at that, because we're trying to look in this gathering about urbanization and women's health from so many different perspectives. These photographs embody actually the theme of the conference. We have also engaged Pennsylvania high school students to think about urban women's health by partnering with our own very first lady of Pennsylvania, the Honorable Judge Midge Rendell, and that's by holding our Your Worldview student video contest. Your Worldview student video contest, a mouthful. We asked high school students across the Commonwealth of Pennsylvania to take videos and to submit videos on their views of the impact of cities may have on women's health and what might be their ideas for solutions. So students with their teachers engage in dialogue about this. It is really about consciousness raising, about the connection between urbanization and women's health. And we are absolutely thrilled that 10 students of the top 3 winning videos are here with us today, and I want you to stand up to be acknowledged. They are right in the back there. You're going to get to see the videos right after the reception. So all of you, I hope, will be here because that's also before the CARE movie that's going to be narrated, and it's about women in other countries. So we have all this in store for you. Now, in the course of the next 3 days, this is only for tonight. We're not going to sleep tonight. There is just so much going on. But I know you're so excited, and you have been flying for a long time anyhow, so who needs sleep now? But in the course of the next 3 days, we are focused on a different area. And conceptually, we want you to think about that with us. So tomorrow morning, we will begin at Annenberg Center for Performing Arts, and we are going to examine urban spaces. So tomorrow is about urban spaces. That's the physical environment and the whole environment. Friday, we move, and the impact on lifestyle, of course. And then on Friday, we will focus, and it's going to be at the Inn at Penn, Hilton Inn at Penn. We will be spending the day focusing on the lens of public health on women's lifestyle. So from space, then we go to women's health public health. And then on Saturday, then we search for solutions and we think about the future. So putting all that together, we don't leave without solution. There are some excellent solutions. And there are also the future, a vision for the future. So that's wrapping it up. Achieving healthy urbanization in all countries is a global and shared issue. And that's really, it's not one country or the other, and it requires partnerships. And I think this is, if you look at the program, you will see that we are modeling what we believe in terms of partnership. We would not be here without just amazing collaborators across the university, across the city, and across the state, and in fact, across the world. And that's how we are going to find solutions. We are fortunate to have a wonderful foundation here at the University of Pennsylvania to build on this growing momentum in urban women's health. Our past president, Dr. Judith Rodin, set us on a path years ago that focused on defining a new role for urban universities. So other schools were building walls to protect themselves. She opened up that and connected us with the university and with other campuses. Our current visionary president, Dr. Amy Gutmann, who is going to be giving the keynote this evening or this afternoon, is creating a future of interdisciplinarity. She's leading us by fostering integrative knowledge and by integrating science, and believes that there are no issues that are going to be solved until we integrate knowledge and integrate science. And she's done that by creating bridges for all of us, which is exemplified in this conference that brings together architects, designers, epidemiologists, urban developers, nurses, physicians, to define the problems and develop the solutions. President Gutmann has challenged us as 12 extraordinary schools. We have 12 schools on this campus and 5 centers to focus not only on integrating our knowledge, but she also challenged us to translate that knowledge by actually doing something in the community and showing that this knowledge is working in the community and evaluating it. It's the mandate that she brought to us that we all believe in, and each school and center definitely have, if not only adopted, created. And the mandate is to engage locally and globally. Your partnership and participation in the next few days is about integrating knowledge. It's an exemplar of that, and it's integrating knowledge for women, which affects families and affects community. So we are absolutely thrilled that you have taken time and decided to cross the globe to attend this empowering and very important conference that should have implications for all of us in so many different parts of the world. And we all look forward, everybody who worked on this very diligently, look forward to meeting each and every one of you and hearing your ideas about what we could do. And now it is absolutely my honor to invite my partner, our partner, a strategic partner in planning this major conference. This is a person who directs the Urban Research Institute, who knows everything about urbanization, and whatever little I have learned, there is a lot for me to learn from her. So she is Dr. Eugenia Burch. She's the Lawrence C. Nosdorf Professor of Urban Research, Chair of the Graduate Group of City and Regional Planning, right here, and she's in the School of Design. She's co-director of Penn Institute for Urban Research, which is Penn IUR. You're going to hear a lot about Penn IUR, and she is a co-editor of City in the 21st Century series, which is produced by Penn Press. Please join me in welcoming Dr. Eugenia Burch, our partner in this.
Good afternoon, and thank you, Afaf. And I think before Afaf sits down, we should give Afaf and her team a big hand. The spirit, the energy, the imagination, which you've just seen displayed here, is going to flow through this entire conference, and I'm very proud to be a partner with Afaf and with her team here at the School of Nursing. I'm just here to remind us about how important urbanism is. I've come back a week ago from the World Urban Forum that was held in Rio, and in fact the image that you see in front of you is an image that was in the newspaper, El Globo, in Rio, which was discussing what the theme of that forum was. The theme was bridging the urban divide and fostering the right to the city. Here are ideas that we will be working with here as we think about global women's health. Because after all, global women's health is a universal issue, but we know that there is an enormous divide between those who have the health facilities and the health services and all the other things that are associated with it, as you see in this list of things on this slide. And as Afaf had said earlier, that health is not a single siloed activity, but it is totally related to the various other kinds of services and the various other kinds of activities that we see are so important in cities. Jobs, education, prevention of crime, the provision of infrastructure services, and so forth. Just the idea that 1 billion people are living in these kinds of shacks that you see pressed up against the luxury apartment buildings that we see in this image as well is a reality in much of the developing world and is actually a reality in our world, though it's not so stark. So as we think about the global issues of women's health, I hope we will think about it holistically, and we'll think about it collaboratively, and we'll think about the various sectors that are going to be so important to solving the problems. They will be the public sector, the private sector, and the non-governmental sectors. And you all represent those sectors here today, and I'm very much looking forward, as you are, to what will be proceeding in this conference as the days go forward. So thank you, Afaf, for letting me partner with you, or us partner with you, and we look forward to this conference.
Thank you, Jeannie, and we're really looking forward to learning a lot more about this. And this was another powerful conference, but it probably didn't talk much about gender there, did they?
They have a lot of women.
Right.
And you will have one of the stars of the conference as a speaker, Sheila Patel.
Oh, excellent. Okay. Well, thank you for being there and being here. Now, it is absolutely my great honor to introduce to you to Dr. Patricia Davidson. Fondly, we call her Trish. She is the professor and director of cardiovascular and chronic care Center at Curtin University of Technology in Australia. She is currently the president of the International Council on Women's Health, ICOWI, as we got some, I think some people say ICOWI, but most of us say ICOWI. And she is, as a president, she's soon to become the Council General. I have 2 more days as the Council General, and then she becomes the Council General, and she's going to take it to this organization to far new heights and take it, as our president says, from excellence to eminence. So please join me in welcoming Dr. Patricia Davidson.
Well, thank you very much, Afaf, for that introduction. And I was just sitting in awe looking at Afaf and thinking, I've got to do that job. It's a bit scary. So Dr. Birch, Dr. Carpini, Judge Rendell, members of the Organising and Planning Committee, my fellow board members and delegates. On behalf of the board, it's my honour and privilege to welcome you to our 18th Congress. And it really is a great honour and delight to be here at the University of Pennsylvania. Coming from a very new country, it's pretty amazing just walking around this amazing campus and reflecting on the origins of Penn. And certainly, you know, there's some very deep-seated traditions here that are really empowering and identify where we've come from. The foundations of Benjamin Franklin, the great man of enlightenment who was such an advocate for human rights, and in particular was one of the very early advocates for women's rights. And certainly internationally, President Gutmann is a leading light, and her scholarly works on liberty, education is certainly an awe and inspiration, and interfaces very much with the goals of our organisation. At each time of our biannual conference, and we come together as a board, it's often time to reflect and think, you know, where is our organisation going and what is our unique niche? As you're aware, there's many NGOs operating in the women's health space, but I think our organisation has some really unique attributes, and I think to be here at Penn really echoes really our vision for the organisation for the future. Certainly through research, advocacy, support and mentorship, they have great potential to advance women's health and well-being internationally. I think it's wonderful to see really many colleagues and friends in the room, and it's wonderful to see many of Dr. Melissa's students who have really gone on to leadership positions in their country. And certainly it's no disputing the fact that through education comes really empowerment and that capacity for advocacy. And certainly women's place in society is a great marker of the health and well-being of communities. So it was wonderful today at our pre-conference to see some of the wonderful doctoral students here at Penn from Lebanon, South Korea, who are going to go back to those places and be leaders. It's really, truly inspiring and motivating. The other thing that I just really wanted to tell you about was our organisation, as it traverses the world with these congresses, leaves some footprint. And even though there's 400 people here at this Congress, the activities disseminate broadly through the community. I think last count yesterday there was nearly 5,000 hits on the website, on the International Council of Women's Health Issues website linked with Penn. So certainly that means that many people who would love to come but couldn't come have access to that information, and certainly that stimulates interest in women's health and well-being. our meeting in Botswana had such an amazing media impact. I was even on Botswana, the president, Dr. Melise and I were on Botswana TV. We had able to have meetings with the Minister for Health and certainly really bring to the prominence some of the very important issues there. I'm very proud to say that in Australia, we now, with a much more sort of favourable government, are now developing a national women's health policy, which I think many people contributed to when we had our meeting in Australia several years ago. I'd really like to thank the organising committee and celebrate their achievements. It's certainly a sterling effort, and I know how much work it is, and on behalf of the board and the members, we really thank you very much. I think it's great to see the genuine cross-institutional support here at Penn, and it really is, you know, a great commendation to the institution to see cross-faculty collaboration. I'd really also like to commend the Penn Rockefeller Scholar Initiative. I think that is a fantastic achievement of this Congress, and it was great to meet many of those scholars, and I hope they have a really inspiring and motivating experience, and I'd really like to commend them for that. As Afaf mentioned, there's a particular mark in history coming today, and we really sadly want to really recognise the tenure of our current Consul General, Dr. Melise. But as we say in Australia anyway, you can run but you can't hide. So even though she's stepping down from the board, from that formal position, she's going to stay and hold our hands for the years to come, and to really has generously agreed to maintain much of the secretariat or the infrastructure here at Penn. So I'd really like to, on behalf of the board, just make a few little comments about Dr. Melise. It's not in the script. I thought, can I get away with this? I'm a brave woman. Yesterday, one of her colleagues said to me, "She has opened up my world." And as a colleague and scientist and an advocate for women's rights and women's health, I think that's a more fitting tribute could not be said. But through opening up all our worlds, she's given many of us many opportunities, created new friendships and alliances, but also through opening up our eyes, she's really identified some of the responsibilities that we have as global citizens, how fortunate many of us are in our lives, and the work we have to do ahead. I'd just like my fellow board members just to briefly join me here, as we just would like to make a small presentation to Dr. Melise. We're just here. Yeah. Some of the board members are still flying in, and we'd just like to present you with this small token of our esteem, and really, on behalf of all of you, acknowledge Dr. Melise for her great contribution to our organisation and to women's health globally. And we look forward to a long association. And again, on behalf of the board of the International Council of Women's Health Issues and our members, we thank the University of Pennsylvania for their great generosity in hosting this meeting. Thank you.
You're not allowed in this room. You're not allowed to be on the podium. Thank you. This is beautiful. This is very, very special.
Okay.
And one of the things that I have to teach you is that when it's not in the script, you don't include it. Thank you. Thank you. So thank you. This was very, very touching, and I really appreciate it. And my colleagues on the board, we have done a lot, and we still have to do a lot. We are, when I still look at those pictures, the photographs today, and see the poverty, and I see the anguish, and I hear the stories of women, I say, did we do anything the last 20 years, and how much more we need to do. So thank you. That was very touching, and I look forward very much to your leadership, Trish. Now, it is my absolute great honor to introduce somebody who has been a partner in everything we have done. First Lady of our state, the Honorable Judge Midge Rendell, who wears lots of hats. She has, in addition to 2 full-time jobs as First Lady of the state, judge on the Third Circuit of the U.S. Court of Appeals, Midge Rendell wears an additional hat. She has served as a member of the School of Nursing Board of Overseers since 1999, and she actually chaired the board until very recently. She's a member of the executive committee of that board. She played a very integral and vital role in planning of this conference. She is a member of our executive advisory board of the conference and really connected us when we talk about partnership for bringing a group of people like this together to talk about some important issues. You need partners in the state too, and she has been our partner in the state. She also spearheaded the Your Worldview Student Video Contest that we held for high school students across the Commonwealth, and they are sitting in the back there, which you will hear a lot more about later on, and you will get to see those videos. She has been a partner in every meaning of that word. So we thank you, Midge, for your remarkable vision, for your strategic thinking, for your creativity, for your leadership, and thank you for being with us today and sharing this very, very important occasion with us, and for actually helping us come up with also some solutions. So please join me in welcoming Judge Midge Rendell.
Well, Afaf mentioned my many hats. The most fun hat that I wear is my FOA hat. That's Friend of Afaf. So that's the best hat that there can be, as I'm sure all of you who know and love our dear Dean here can appreciate. My role here today really is to bring you greetings, to welcome you to Pennsylvania and to Philadelphia. We're so happy that ICOE's 18th Congress on Women's Health Issues, Cities and Women's Health, Global Perspectives, is here in the Commonwealth of Pennsylvania. And our governor, Ed Rendell, who happens to be my husband, sends greetings. And I have a proclamation here that I'd just like to paraphrase some of the sentiments. He says, "It is my pleasure to welcome everyone to the University of Pennsylvania for the 18th Congress of the International Council on Women's Health Issues. This year, the conference theme focuses on the health of urban women. Here in Philadelphia, we can see a clear disparity between the health of urban women and the health of women statewide. For instance, recent data indicates that 63% of Philadelphia women are overweight, compared to 55% of women statewide. Also, 35% of Philadelphia women reported that they engaged in no leisure time physical activity in the past month, compared to only 26% of women statewide. Our state and local health departments, in cooperation with community health providers, are making strides in addressing these disparities, and recent health care reform policies will no doubt make access to better health care easier for everyone. However, there is still much room for improvement. I look forward to new ideas and actions that will be produced this week as a result of your discussions. As Governor of the Commonwealth, I thank you for your dedication to improving women's health and wish you the very best for a successful conference and an enjoyable stay in Philadelphia. Signed by Edward Rendell, April of 2010. So Ed sends his best wishes. He is a big proponent of health and of health care for women, because as we know, health care for women means health care for the community, because women are the backbone, the heart and soul of our communities, as we know. There's still so much to do, and so much you'll be doing this week to develop strategies, to talk about disseminating and communicating ideas for improving urban women's health. But I want to tell you just a couple things that Ed has done in his administration to improve the health of our women and our urban women. For one thing, he created the Governor's Office of Health Care Reform, and it is no coincidence that the chair of our Overseers Board, who was introduced to you a little while ago, Rosemary Greco, who is here with us, led that Office of Healthcare Reform in Harrisburg. And they accomplished so much, working on issues ranging from medical malpractice, community health reinvestment program, to revamping the way Pennsylvania delivers long-term living services. But the most important project was the bold Prescription for Pennsylvania, a blueprint for improving access, quality, affordability of health care. I just want to tell you a couple of the accomplishments. Enacting the country's toughest legislation to reduce the state's $3.5 billion in unnecessary health care spending resulting from health care acquired infections. We hear a lot about that, but we're doing something about that. And it's very important in our urban areas with our hospitals. Redesigning the way care is delivered to individuals with chronic conditions in the nation's most cutting-edge and comprehensive initiative. Ensuring that healthcare practitioners are permitted to practice to the full extent of their training to better use medical resources. And creating the Pennsylvania Center for Health Careers and Health Careers Leadership Council to address healthcare workforce issues, including shortages and lack of diversity in our healthcare workforces. The council is an initiative of the Pennsylvania Workforce Investment Board. And just one other thing I want to mention that I thought is very innovative, done by our Pennsylvania Commission for Women, under the leadership of the executive director, Leslie Stiles. They developed Pennsylvania Women's Wellness Kiosks, which are interactive kiosks that have information about obesity, chronic lower respiratory disease, cancer, stroke, diabetes, and are easy to use and access for women who can't make it to the doctor, they don't get to the clinic. But these kiosks are located in places where women go. They're in the markets. There are kiosks in prisons where some of our urban women end up. And when they can't see a doctor, can't get health screening, they go to the kiosk and access it for information about health issues. So I want to applaud what our governor has done, what Rosemary Greco, our chair of our overseers, has done, and what our Pennsylvania Women's Commission has done. And I'm looking forward to hearing all of the ideas that come out of this conference because, as I said before, as the health of women goes, so goes the health of our communities. Thank you very much.